folks. I think we're going to go ahead and get started. Today is a little bit different than what we normally do in our webinars, because usually we're typically bringing a very specific subject matter expert to a topic. We do have subject matter experts on this call for sure, and the topic is something that we're near and dear to because it is about the rollout of a new solution that Childcare 360 has been working on now probably for the past year and a half, on the bequest of our members, as well as the fact that I've known as owning and operating childcare centers has been a distinct gap in the need for healthcare benefits and some additional voluntary benefits in the area of ECE and childcare. For that reason, we are having a series of these webinars that are going to be available to not only you, but to others to take a look at. And we are recording this session too, so if you want to come back and take a look, there's no problem with that. I've invited a few guests to join us today, and we'll get through that in just a moment. And this is about Childcare 360's ECE Healthy Advantage, and it's about increasing the value of the benefits you offer. So today's agenda, what we're going to do is we're going to talk about an introduction and talk about who we've partnered together with us to get a very unique offering for you and for your staff, if this makes sense for you. We're going to go through a program overview as well as look at the specific medical benefit program, and then other plan offerings, as well as some of the elements about the plan, and then look at the administration of the plan as overall next steps. There are going to be some follow-up sessions in here, and tomorrow as well as Thursday, you will see that in your registration, it'll be posted a couple times in the chat button in the registration, but in your chat button, there is an opportunity for you to register for additional sessions to get a deeper dive to answer more of your questions. Those deeper dive sessions will be Wednesday and Thursday, as well as next week, we'll have another introduction session, and it's going to be running every week on Wednesday. So the first one is July 15th, but every week we'll have an introduction session at 1:30 to 2:30, which allows you to go in and interact with the team. Here, since we're doing a rollout, there may not be as much time to answer questions. We hope to. If you do have questions, please put them in the Q&A. If we can get them today, please do not put them in the chat, but if you could please put them in the Q&A, we will be sure to get to those questions either hopefully before the end of the call, but if not, we will respond to them via email so everybody gets to see the answers. With that, let's move forward. So we're talking about the partner program. So Childcare 360, obviously your business partner for supporting your childcare and your ECE centers for success, has partnered up with a national $2 billion firm, and that's USI. USI is a broker service, and the reason we need to work with a broker, and you'll see John Lynch. Welcome, John. How are you doing? I notice he's on mute, but once he gets off of mute, there he is.
Hi, Tony. Thanks.
How are you? And with that too, we do have a couple other partners on here that make up the overall mix for our solution here. And the reason for us having a broker is because these programs need to be licensed to be available in all the different states, and our broker, who is licensed in all states, can represent it. So we did put this program together with John and USI, so they are the broker relationship. SBMA is the benefit provider. So the medical services and how the medical service program is managed, how it gets reimbursed, all those elements goes to SBMA. And SBMA, again, this is not a major medical plan, but this is a very healthy employer contribution plan that we will talk about, minimum employer contribution plan that we'll talk more about. And SBMA is a nationwide organization who works with thousands of different providers in the industry. And last is our enrollment specialist. Core Enrollment Solutions, or CES, is the name of our enrollment specialist. We'll talk about them later, but the combination of them, along with our benefit provider, along with a broker and Childcare 360, we believe is going to be a big differentiator and a big advantage. So we're going to just tell you up front, what we're going to talk about today is why would you want to consider Healthy Advantage? Well, first is it is built specifically for the type of staff we have in the ECE childcare world. We have more of a service staff industry kind of employee. Our staff tend to come and go. There are younger staff, some are coming off family plans. There are individuals who oftentimes don't feel like they need any benefits at all, where other people definitely want more benefits associated with them. So it is definitely created with that foremost in mind. It is very flexible in their plan options. There's multiple plan opportunities here to look at. We'll talk about that. And then what we have done is we've negotiated national pricing with our partners because of the footprint that both Childcare 360 have. But the fact is, in this target arena who could take advantage of this, there's about 65,000 childcare and early learning Montessori centers throughout the U.S. who may have an interest in something of this nature. And then we believe that we have a real differentiator about the benefit administration. Oftentimes when you have programs that might be a major medical program or something you might have from a local broker, they don't have the kind of benefit administration. So a lot of your own team has to work with staff with both a broker, if not the end provider, as a liaison. Well, we have hopefully a nice solution there too. And then hopefully you see as Childcare 360 is that trusted partner. So one of the things I first wanted just to go through is what we call our business success model. We believe that the core element of success in any kind of childcare ECE world is really the engagement of your staff. If you engage your staff, you will engage your families. If you do that, you have the opportunity then to really grow your enrollments and grow your reputation. Because at the core of it, if your staff are fully on board, if they're working for you, if they're helping you run and operate your center, and they're energized and they're the right people in the right seat, your growth will continue. That gives you time to focus on and optimizing your operations, which will simplify your business, hopefully have you prosper and thrive. So when we look at what is important about recruiting and retaining, we really see that falls into four separate buckets when it comes to staff. First you have up here is job postings. As we all know, whether you use Indeed, Craigslist, you put out ads yourself, it is a bit of a nickel auction out there on the way that you recruit. To see success in recruitment, for my 30+ years in HR services and recruitment and retention, I used to own a job board in Orlando and got really familiar with this element of it, is you really need to focus on what your culture is in your job ads, but also your benefits have to be compelling. If not, people are coming only to work for the dollar and they will leave for the dollar. Recruiting is the same thing. When you're bringing them on board, you are discussing your values, you're looking at their experiences as well as the experience you can provide them, but your benefits is critical. And then you want to discuss with them what the total compensation package is. So they're not just going over to Arby's or some other place because they see $15 an hour when they're getting so much more for a comprehensive plan. And then you look at onboarding. Once they have joined you, it's really about, is their handbook aligned to them? Is there an orientation to really get them to feel comfortable that they've joined the right company? But are you also onboarding them right away to their benefits so they feel that security? And then are they getting the kind of operational procedures? That is also critical for the recruitment and the retention of staff. And finally, on their ongoing career, really this one could extend out for a ways. It's really about ensuring that they're a cultural fit through the ongoing professional development training, the experiences they have, the fit into their culture, but keeping them there as part of benefits so they don't have to worry and they don't have to look all over places because they go, well, I just have a benefit plan option at another company where I really don't have one here. So it's really important in your whole life cycle of bringing an individual on. So let's talk a little bit about what we're going to be talking about today, and that's the 5 medical plan offerings, 1 dental vision plan, 4 voluntary plans, and then the benefit administration from the rollout, the platform, the management, and the support. Now, we're going to get in deeper with the pricing on the 5 medical plans. But we're not going to get into deeper dive with dental and vision, which is, by the way, one combined benefit. That's not separate. You get that together. And then there's 4 voluntary plans that we'll talk about, but we're not going to get into the pricing today. But if you do want to learn more about those programs, as well as a deeper dive into healthcare benefit, that's what that registration is in the chat function. Okay. And so the overview we're talking about right now is the 5 different benefit program options outside of those voluntary and the dental. And this is the telemed plan, the basic, the preferred. Well, we have some, I noticed 2 different names here. We actually changed these names out, and you'll see the new name changes over here. For one element that's really important from our basic plans is all of these plans cover at 100% preventative care and wellness. This means that even at the lowest level plan, with its focus and its cost being very competitive, you will see there are, for both children, but as well as parents, their annual physical, to mammograms, to different kind of cancer screenings, to immunizations. So there's a lot that comes with these plans, just standard. So with that said, let's jump into the medical benefit overview. And what I'd like to first do is I'd like to talk to you first about an example. And the first example I'd like to talk to you about is what major medical. Now, major medical, as we know, is different in every state. Major medical doesn't compete between states. They basically have a captive audience within a state. Each state has different major medical providers that are licensed in your state. You may have a Blue Cross Blue Shield, you may have a United, a Kaiser Permanente, a Cigna. There is many of them across the US, and depending on where you're coming from, you may have your major medical plans. What we did here is we took an example of one that actually happens to be a local plan that prior to us bringing this Healthy Advantage on, we actually used at our centers. And this was based on a Blue Cross Blue Shield plan. It was one of their bronze plans. And what you see up here is it's a major medical plan. There was no minimum fees for just to have the program, but there were employee contributions, and there are employee contributions because typically you pay 50% of the plan. So the overall premium, depending if you're one individual, if you're an individual with a spouse or with children, or if you are one that is for the entire family, these are the full cost of the plan benefits. And then up here would be the plans that the employer is contributing. All right. You would receive 100% for wellness for these major medical plans. And again, this is just an example. This may not be exact, but the big deal here is a $6,000 deductible, which all of us are familiar now with high deductible plans. You know, there's HSA savings for those things, but basically saying that you keep on spending, you go to your office appointments, your specialist, any lab work, you pay out of pocket the full amount for what that doctor has negotiated with Blue Cross Blue Shield. You pay that out until you exhaust that $6,000. We're just talking for an individual right now. And that's an awful lot to exhaust in a year, especially for young, relatively healthy people between the ages of their young 20s to pretty much their 40s, maybe even early 50s. And typically in our industry, they're female. So those ladies oftentimes, being mostly healthy, never get to see where these benefits are playing this 100% after they've gone through. But there's a big difference. Major medical offers a lot of elements that include all kinds of hospitalization, but we'll get into these direct here. And there is no monthly setup fee here. There is no setup fee and no monthly fee for these programs. But again, the big thing is $6,000 deductible, high premiums up front. Now let's give you a look at what our programs are. And what we will show you here is there are 5 different programs. These are set up in these towers here, okay? And within these towers, we have the telemed, we have the basic, we have the virtual, we have the ultra, and then the ultimate plans. First, we're going to start off with the owner premium monthly plan. And what this means is how much does the owner pay at a minimum? Now, as an owner, you can choose to pay more. I've rolled this plan out to all my employees, and I've done the minimum candidly. So I pay $25 an employee for these plans. I'm not paying these rates over here, but I'm paying $25. If I had just the telemedicine, I would have to pay $10 just for the telemedicine. All these other plans include a telemedicine plan within them. Then you look at the employee plus spouse, the employee plus children, and then family benefits. So this plan starts as low as $45 to $135. What does that cover? This covers 100% of the wellness and preventative that we just discussed. Plus it gives you a full telemedicine plan with zero copay and a discount card for any of your generic pharmaceuticals. And John, you're welcome to jump in if you have any commentaries, but I'm just going to keep on cruising. You will notice as the programs increase here, the rates slightly increase, but as the rates increase for the employee, okay, they get additional benefits. So in the virtual, the bigger difference right here is that there is behavioral health 3 times a year, and it's a $50 copay. So going to see a psychiatrist might be something that someone is really seeking, and honestly, that pays for itself a few times over if you look at the cost without insurance to go see a psychologist. In addition to that, what you notice is highly compelling generic drug costs of $10, as well as tier 2 at $25. That's a very compelling drug cost for most. You look at the Ultra, again, the employer paying $25, the rates just go up slightly here overall, but now you're getting $15 primary visit copays, as well as network discounts for specialists, $50 to go to an urgent care. Now, typically $50 is very low for an urgent care. Even with maybe having, a major medical, you'll pay up to $150, sometimes up to $175 to $200 if you're paying directly out of pocket for an individual. And why do people use urgent care so much? I think most of you know this, is people are working throughout the day. They get home, one of their children ends up having a fever, because that's when fevers or the like exhibit. And so people then either have the choice of the emergency room, they can call their pediatrics, and their pediatrician may say, just come in the next day, which they typically would, or they're going to have an opportunity to say, with telemedicine, visit telemedicine, which these programs have at no cost, or you have an opportunity to go into urgent care. So these programs continue to get rich, but realistically, when we look at this richest plan here, the Ultra plan, it's not very expensive for what it offers. Again, the employer only paying a minimum of $25. You can pay more, but the employee only at $120 for this plan, paying from $1, where over here the employee is paying, maybe in this example, $155, but has a $6,000 deductible. Now these are what they get: $15 office visits, $15 specialist visits, behavioral at $50, urgent care, going to get an x-ray at $50, including all of your physicals, including mammograms, things like that. And by the way, if you're at a physical and part of the physical is to have blood work, that all comes with it too. And then you'll notice, yes.
I'm sorry, if I could just interject. A couple of questions have been asked in the Q&A
Sure.
regarding some of these types of visits. I'll point out as you did earlier, all 4 of the medical plans, sort of above and beyond the telemedicine program, cover preventive services at 100%. When you move into other programs such as the Ultra and the Ultimate plans, that's where you have more diagnostic services provided. So for example, that's why you see a primary care visit has a $15 copay under the Ultra and the Ultimate plan for a person going for a diagnostic visit. For the child who's sick in the morning and the father or mother wants to make an appointment with the primary care the pediatrician that day, that primary care visit would be a $15 copay for that diagnostic visit under the Ultra and the Ultimate plans. So I think that might answer the question, one of the questions in the Q&A. Another question was related to the type of coverage and how are these different from a true medical plan. Tony is referencing on the far left of this screen at that example of a true medical plan. I think that's what you might mean by that question, of a major medical Blue Cross Blue Shield type program. You might think of it as a traditional medical plan. These IC360 programs are very intentionally different, and yes, in some ways are lesser benefits, but as Tony has identified, it's intended to target many of the demographics that are represented in your employee populations. These plans, like any type of medical program, they're not intended to be for everyone, quote unquote. This is highly targeted towards the demographics that are in play at many of your organizations. So hopefully that answers your questions, but keep the Q&A coming.
Absolutely. And just for people who recognize, with my own centers, I was just previous to this, I was offering major medical programs and a couple of voluntary benefits. And I had only 3 staff out of my 80 who took up major medical because the costs were so high and the deductibles were so high. It was offered to a lot of my staff who still didn't take it, and they had to have some level of tenure. Now that I offer it to my entire staff, after 30 days of starting with this program, we still have 1 staff member who chose to stay on major medical, along with myself as the owner. And we had, I believe, somewhere in the area of 30 of our staff chose this program. And the great part about it is it's only at $25 for me cost per month per employee. But it gives them now, it fits a gap. It fits something that helps them out a lot. But it allows us to have both the major medical offering as well as adding this program in. And to learn more about the specifics of that, I would encourage you to register for the session tomorrow or Thursday, as well as possibly next week if you can't make that. So there are some additional costs here, and there are some platform costs, and we'll get into why those platform costs happen. First, there is a one-time setup fee, and this is for the very first time IC360 is offering something outside of our membership. Typically, you could only get what Inspire Care 360 offers within its membership. This time, you will be able to get something outside of the membership, but you're going to clearly see where membership certainly has its benefits here. There is a one-time setup fee because there is a lot of coordination going on where we're capturing a lot of information. One of the things we've done ahead of time is we looked at all 50 states to make sure that providers would be willing to take these programs in your regions. This is not an absolute guarantee everywhere in the US. However, when we've done that look, we looked and found that every location that a member of Inspire Care 360 is today has plenty of providers who offer this program. And if you were interested, we would also be able to conduct a census for you to ensure your coverage is very thorough in your area, which is what I want. There's one thing to have an insurance benefit and fine. There's another thing though to actually be able to use it. And our critical element is, which I challenge John and the team with, is we need to make sure everybody can use this, not just to have it. So that has been critical. There is a monthly platform fee, and that platform fee allows us to offer this comprehensive program as well as the benefit administration that you will see, which you'll see easily pays for itself in an instant because of the lack of work your team doesn't have to do anymore because it gets taken over for the administration of the benefits. And then additional location fees that if you have more than one location, is $45 additional for that location fee a month. And you'll see there's different charges for being a non-member here. And then the owner fee is $25 right up here for these plans. It's still $10 for the telemedicine plan. And there is a $30 fee for non-members if you're not a member. But we're also seeking a 10 life minimum. John, before I move on from here, do you have any other insights or questions?
No, thanks, Tony. There are a few more questions being asked about medical coverage details. I would suggest, Tony, that we continue through your presentation. I know in the follow-on sessions tomorrow and Thursday, more details like that will be covered. Perhaps if there's time today, we can circle back. I'm just not sure I know we intend to cover that in the follow-on sessions.
Sure.
So I think in the interest of time, we should move on for now.
No,
through your
and I think it's a good idea. Thanks, John. And we're going to move on. For everybody out there who's wondering about, we want to make sure we don't expect anybody to sign on to this program unless you have all the detail. So the follow-on session is to take a bit of a deeper dive jointly. And whether you like what you see here today, or you go and see the sessions tomorrow and then you like that, then what we do is we schedule a one-on-one call and get into all your questions with you, that are very particular to yourself. So you'll be sure to get every question answered if this is a program that you want to consider for your team and your staff. So what I'm going to do is I'm going to show you a worksheet just as an example here. And this worksheet is, again, we're using this major medical, which is only an example. This is not every program. As you guys know, you talk to your local broker, you get a major medical plan. They give you like 15 pages of 15 different examples. And just imagine that across every state with every kind of carrier, they're all different. But just using the example I used before, which is based off the one my centers have had, we had if you had 6 staff individuals that had premiums that for themselves, it's $375 for the overall premium a month, where then the employer pays half and the staff member pays half. There's a $6,000 deductible before any coverage is provided other than your wellness. And then your employee is paying a year, they're paying $2,244 for premiums alone, again, before any of the coverage. That's what one employee is paying. You as an employer taking half of this is at 187 times the 6. You are paying a year that $11,220 per year. Then you have to look at the cost of administration, enrollment, management, your payroll, all these things that you need to do as part of it to roll it out. When you look at the total cost of $13,464 plus your administrative costs, this covers 6 staff. Now let's look over here and look if the situation, if you had major medical still, but you took on Healthy Advantage. Let's say you had 2 of the staff stay on major medical, similar to like what I have in my organization, and then you wanted to offer 20 plans. Okay, overall you're offering 22 plans then instead of 6. Let's say that 10 of them were just the basic plan, which is at $45 a month, or a year, an individual's paying $540. And 10 on the ultimate plan is $120 a month, which the premium is $1,440, okay, for the entire year. The employer premium for major medical is $4,488, but almost just closely behind it for 20 individuals, the employer premium is $6,000 a year. So there is the platform fee that we spoke of on the other page. So your total cost for covering 22 people is $13,488 for 22 as to 6. And as a reminder, your employee still is paying a lot more. Yes, they have probably more coverage, but that's after they get through the $6,000 deductible. Where over here, you have your employee now being able to pay a very affordable. When you look at $540 or $45 a month, this is only like $11.50 a paycheck if you pay weekly. So, or on an ultimate plan here for an individual, as you can see, it is, you break this down by 4, you only took about $30 a month or for per paycheck to cover them for the ultimate plan for an individual. It becomes much more affordable for things they may just need. So now we're going to move on to some additional benefits. And the additional benefit programs, we're not going to get into a lot of the detail of the full amount of coverage, but we do have dental and vision insurance with those programs that we'll talk about more tomorrow, as well as accident insurance. And these are voluntary add-ons to the healthcare benefit. You must have the healthcare benefit programs here to take advantage of these programs. The specific disease, critical illness insurance, and hospital confinement indemnity insurance. Okay. Please go ahead, John.
Thank you. If I could just chime in for a moment. In our firm's research, and our work at USI, when we looked at this market and the benefits that member employers such as you are providing to their employees, oftentimes, understandably, it was a benefit very focused around medical coverage. And then occasionally one or two or perhaps three of the plans that are listed here. But very rarely did we find employers able to put together this type of package of programs. So to Tony's point, this is a package of programs from which your employees may choose. But in determining what would be a valuable package, we recognize that by offering all of these programs, it's a very robust package that we didn't find was occurring frequently in the market today. So this is a big part of the value of this program, is making these types of plans available for people to choose if they would like, because employees' needs vary so much one to the next. And among the demographic that Tony identified earlier, some concentration of younger employees, for example, they don't place as high a prevalence on medical coverage. So some of those employees look to these types of voluntary plans to fill a void that they recognize they don't control. So for example, you could talk to a 30-year-old employee and they will say, they won't say literally, I'm never going to get sick and I'm never going to die, but that's kind of how they behave. But these types of voluntary programs can help fill in a gap if something fully unexpected were to happen.
Okay, great. And I appreciate you going through that, John, because I'm also trying to, look at some of the questions. And folks, for those of you who have very specific questions, if we don't get to them, again, we'll answer them after, or you can please look to attend for the sessions tomorrow with your questions so we can get into them. We are looking for the plan. Someone just asked me again, we're looking for a 10 employee minimum as part of the other page. To have that for 10 employees to participate. If not, it basically is just a $250 a month minimum since it's $25 per employee. So it would be an either or status. That gives us, and the reason for that is because what we are doing is when we put this partnership together, we are seeking a certain amount of volume that gives this volume to our program provider who extended these rates to us. And even if you did pay, for instance, $250 because you only had 8 people participate, so instead of paying $200 a month for those 8, you pay $250, I think you'll find that the benefits are highly substantial to what you would get. But we could talk about that more later. So let's continue on. So with the program elements, again, and trust me, rolling this out within an hour and be able to cover everything, as you could probably imagine, is not simplistic, but we will try to get to as much as we can. So the total program packages include the medical, the dental, vision, and the voluntary plans. An employee may choose to enroll in any or none of the plans offered. So typically what we seek to do is, if we engage with you and you are interested in offering this, you can choose your full staff of employees. You can designate that maybe employees that have had 1 year of service or 6 months or 30 days of service. You can also designate, and John, correct me if I'm wrong, but sort of lines like my administrative team can have this program or my overall staff can have this, but you cannot pick and choose individual employees because that is a discrimination and that is against national or federal state laws on choosing and picking certain individuals to receive it where other people can't. John, do you have any thoughts on that?
No, that's correct, Tony. That's a good statement. You as an employer, part of the structure of your benefit program will be to have employees, and you hopefully already do this, allow employees to pay their premiums on a pre-tax basis. And the technical reason, or what allows you to do that, is what's called Section 125 of the Internal Revenue Code. Just like Section 401k is for a certain type of retirement plan, Section 125 allows for pre-tax deductions, but Section 125 comes along with discrimination testing along the lines of what Tony has described. So as an employer, you can't pick and choose, and you likely wouldn't want to do that anyways. But you can define sort of just to a degree, eligibility and contributions based on subgroups of employees.
Yeah. And another reason for the minimums, thanks, John, for that. And just complete transparency, because that's what I hope to bring to you guys and my team, is that if you were to select and just give these programs anyhow, if we didn't even have the discrimination testing, just to the people who just use it all the time, use the insurance benefit all the time, it for everybody in this chain on the side of it, there is just paying out and there's not any money coming in. So the plan definitely needs to get funded by having employees be part of it. So that's why we do have the minimum. If an employee is currently enrolled in a traditional major medical insurance plan, like Blue Cross Blue Shield, Kaiser, United, Cigna, whoever, what are their options? They could terminate their existing plan. However, our benefit liaisons, which we'll talk about, their objective is not to try to take off anybody from a plan that they utilize or they find the need for. It is just to give them an education of what they may have today as to what they have an option for. And that's critical. This is about a long relationship, longevity in the relationship, and being very fair to the employee. So the objective is not to try to take them off major medical now if the employer chooses to discontinue some major medical plans or create more incentives, or just decide to say, hey, we really are encouraging these healthy benefits because we've looked at usage, and usage is very low on our typical major medical plans. Then we can all, help you out in those communications, but you would be communicating to your staff that way. These plans, again, they are not major medical plans, but as you did see, they offer a lot of the basic elements that an individual typically uses within a year. So there's more detail again in those other sessions. And now we talk about benefit administration. Someone asked me if we could have a demo. We're not gonna be able to do a full demo by any means today of the benefit administration, but what you do need to understand is this offering offers a substantial difference. And that is that as part of your program, what comes with it is you will have a local enrollment consultant. In days of pandemic and COVID and lockdown, we're doing those meetings virtual today. Our partner, CES or Core Enrollment Solutions, are the ones who do this, but they have in every city, they can have people come out and do local enrollment work with your new staff as well as your re-enrollment every year during an open enrollment period. And by the way, we've chosen an open enrollment period to be between the beginning of October to November every year after you've signed up. So you can sign up at any time throughout the year. Takes a little time for that. We'll talk about that in a minute. But every re-enrollment is around October and closes in November. So people have the time to learn about the different programs, if anything's changed, and options that they would like to consider. The local enrollment consultant is a non-biased individual who is looking to ensure the individuals, your employees, get set up on the very best plans. They walk them through the different benefit options. They coach them through product and pricing, and also become knowledgeable to let them understand maybe if they're part of a Blue Cross Blue Shield or a United plan or a Kaiser plan or what have you, to say, what is covered, what isn't covered. So your employees can make decisions with their eyes wide open and with transparency, and not feel like either one plan is going to give them everything for a much lower cost, or feel like the other one is going to be like help them out and still provide them the kind of cost needs that they need. So they will be very helpful in that. They also, help out with a once-a-year checkup and make sure that every plan is going well. They're available throughout the year as customer service to give any information, any questions about claims on all the programs or any of the benefits. So imagine this now is myself with my staff. I used to have an individual who was dedicated to handling all the administration, handling all the enrollment, handling all the paperwork, making sure the paperwork got over to our broker, who got it to Blue Cross Blue Shield, made sure that that was handed with Lincoln Financial is for our voluntary plans. They would manage all that. Someone would have a question. It went to that individual on my team. They went back and forth every month. No longer do you need an individual. Yeah, you can have a point person for sure, but they are not going to have to work on this because that's what the local enrollment consultant, which is already built into this program pricing. So it's paperless and it's a streamless process. There is an online app, and the online app is something for your employees to view and look at their benefits at will. It's something that they'll be able to have on their smartphone device, and they will be able to use it as they need. The enrollment liaison works with them and actually fills it out online if they choose to go on board, and they help walk them through and fill out the online application, and it keeps it completely paperless and streamless. The other thing is, this program is called Employee Navigator, this online app. It's a very popular one throughout the nation, and it is already pre-integrated with a number of providers out there. For instance, with ADP or Paylocity or Paycor, there's a number of different providers. And if you use small to mid-size providers who don't happen to have it on there, you could ask them, and oftentimes they will. And that's what I had with mine. I asked them if they would, and they said yes, they would integrate with Employee Navigator. If you don't have one that doesn't integrate with Employee Navigator, that's not a problem. All you do is for your payroll, you get a weekly report that is sent to you that you would just forward on to your payroll company. And that's it. They would give you the deductions that come out. Okay? Any, John, have I taken too much liberty there, or does that sound right?
No, Tony, that's a good description. And I'll just add again, in our research, we looked across the market and found more often than not, employers in the early childhood education space didn't have, for a number of reasons, very understandably, this type of platform. And so in putting together this overall benefits program, we felt it very important to have a platform which makes you an employer of choice as a combination of the ease of the employee education and administration process, along with the variety of benefits being offered. So I think if you're not familiar with these types of platforms, you'll see that this is a very sophisticated, comprehensive platform, very user-friendly for your employees.
Yes, and so one of the things is, you may have heard of MEC plans or minimum employee contribution plans in the past, which this is based off of, and you can see there's many different options here. But oftentimes when you have those plans, as well as voluntary plans that might do critical illness or medical recovery, there's a lot of paper shuffling that goes on in those plans, and oftentimes employees may use some of those plans because of the lack of benefit administration. They don't know what they can use it for. They don't know what they can use it for before they use it, after they use it, about submitting claims. And that's what our benefit administration partner is there for, is to help them through that journey to make sure that they get every dollar of their insurance applied. That's the value of the liaison too, is to make sure they take full advantage of it and get the full value out of it, and take out any of the pain for coordinating those efforts. So that benefit administration is a real big differentiator. That this is sort of like what a large corporations can offer, is this benefit administration, if you've ever been in one or you have a family member who's in one. But here, this is one that we're able to bring into our ECE childcare marketplace, and we really believe it's the first of its kind. So again, revisiting the differentiators, it is built specifically for the ECE and the childcare employee, as we discussed. It has multitude of different flexible options, from a telemedicine standalone plan to 4 other plans, from the basic, the virtual, the ultra, the ultimate, that all include the telemedicine, that also include $25 for the employee contribution, as well as very compelling cost, whether you're an employee, employee with a spouse, employee with children, and employee with a family, and then the different levels of service. And the great part about that is, which I really liked about it when I rolled it out, was I can roll it out to all of my staff, and I know what my cost is going to be of $25 an employee. So I didn't have to look at, if they took a family plan, I'm going to have to pay half of the family plan. Or if they took the highest level plan, I have to now pay half of the highest level plan. So I didn't have a way to budget. So that kept me, always being conservative in the way that I would possibly roll those plans out. So maybe I give it to people who've been here for a year and have really dedicated themselves because I'm willing to take more of a risk as to someone who's been here for 30 days. But now you can use this as part of that recruiting process. So it makes a tremendous amount of sense of how to recruit and to retain. So we did, as we talked about some of the conditions and some of the reasons of why we're seeking some volume or minimums, and we're thinking, how we put this together. But as I showed you in the worksheet, that for what the cost would be for 6, you can cover 22 people possibly. Of course, that can be sliced and diced many different ways, and that was only an example. And then it's an unmatched benefit administration. Typically, again, when you're getting plans for small and mid-sized companies, I'm talking companies that might even have 30 locations, 40 locations. They don't get a benefit administration the way that we have this with our liaisons and our enrollment specialists who continue to be the customer service throughout the year. And hopefully you see that IC360, and most of our members know this, that we're a very trusted partner to them in the sense that we really believe in transparency. And what we say we're going to do, we actually do that. We hopefully underpromise and we always overdeliver. This is a plan that I'm using for my centers myself, and I would not bring it to you if I didn't use it myself. We have other members who are just starting to pilot it, and there are centers that have, one of them has 6 locations, one of them has 11 locations, and they're just in the piloting process right now. But we heard so many people saying that they wanted a plan like this that we decided to bring this. Now, again, we have the webinar scheduled. Again, it's in the chat feature. But if you're also, after you go through that and you're like, you know what, I am really interested in considering this, we will would like to have a one-on-one meeting to go in and talk to you about these programs, how the plans are structured, how they get implemented, how they work, how they benefit you, and how they benefit you year to year. Right now, when you look at these commitment timelines, what you're going to notice is we need about a month and a half from the time that you choose to move forward with the plan to the time it can actually become effective. So you'll notice July 15th makes a September 1st, by August 14th to October 1st, and September 11th to November 1st. The reason for this is that the benefit administrator, the one who's going to be signing up everybody, they're creating a database. Within that database, they're then importing all of your employees' names and information. They're doing the census data for you. They're capturing all that upfront information. So it's not just turning it on and just having someone sign a piece of paper. They are then calling your employees. We are working close with them because we, as IC360, we will send out the initial emails along in conjunction with you to have a very smooth communication process so they understand what the services that they're being offered by their employers in additional benefit, how they're going to get it, what is step-by-step happening, what does the process look like, and then the individual who they talk to will give them the details so they can follow through. Okay?
Tony,
and
if I could just
please
add to what you said briefly on these deadlines you have on the screen, just want to clarify that those dates on the left side, July 15, August 14, et cetera, that's implementation data complete by that date. So an employer can't raise their hand on July 15th and says, yes, I'd like to go ahead for September 1. There is some implementation data that's necessary by that date. I think you referenced it briefly, Tony, a census, an implementation form or worksheet that provides information about your organization, number of locations, et cetera. So there is a set of information that needs to be provided by that date.
Absolutely. And by the way, this doesn't end on September 11th. This will happen month by month. But,
Right.
So this keeps on happening for anybody new who wants to come on if this is not the right timing for you. But as we all know, in the fall, we're all hoping by that time, the lockdowns will hopefully have cleared up a bit. And we're expecting a lot of our families to come back. At my centers, I am literally at 48, in some centers to 56% of my enrollment capacity in centers. So I don't have all my teachers back, but we are going to be recruiting new teachers in the fall because we are expecting to be close to capacity in the fall. So this is going to help me not only retain my staff, but also in recruiting other teachers. So with that said, just as a reminder again, the detailed sessions tomorrow and Thursday, as well as next week, we do have, and then we're going to have weekly sessions after that on every Wednesday that will be available, and people would just be able to register, and you'll see that coming through with follow-up detail. So I do want to thank everybody. We do have a couple minutes left here. John, I haven't had a chance to look at the Q&A. Is there any other kind of questions that you've seen in the Q&A that you would like to address?
Sure, I'll just touch on some of the higher points. As we talked about, the follow-on sessions will get into more detail about the benefits. But if it helps for anybody's initial research, the provider network for the medical plans is called MultiPlan. MultiPlan, as Tony referenced, big national network of participating physicians, labs, hospitals, specialists. If you want to go out to their website and get a sense, you can do that. You can go out to their website, for example, and put in a zip code, and it will give you information on providers within a range of that zip code. Part of our strategy was very intentional, as Tony mentioned earlier, of having a robust provider network, because simply saying you have a medical plan is not sufficient if there aren't providers available for your employees and their family members. So I did want to make sure I touched on that piece. Another question that was asked was, will the rates change yearly? Yes, we expect that they will. To a degree, the rates will be predicated based on the performance of the program, but the rate change is expected to happen on the anniversary date. The anniversary date is November 1 for the overall program. And yes, we would expect those rates to change each year.
So John, let me ask you, is there a when I'm on board rate right now and then a big jump up in the following year? Or the following
No, that's a great question, Tony. The plan rates have been structured so that the plan rates you see now for the medical plans will be in effect through October 31st, 2021. So there is no medical plan rate change for this coming November 1st, because we're sort of pretty close up on that date. So thank you for that question, Tony. A great clarifying point.
Well, and also I think the reason is and for all of you out there, we wouldn't be bringing this to you if I didn't have it in my own centers. And what I don't want is I don't want any surprises. So I don't want a situation where an employee gets a rate of $45 a month to cover the basic preventative care programs because they just came off of their parents at the age of 26 or whatever. And then all of a sudden the next year it's $80. No, if it goes up to $47 or maybe $48, that's okay. So we can't guarantee what those rates will be, but the objective is that these programs do not jump up substantially. They may have slight increases, with the overall cost. Julia is on with SBMA. Julia, do you mind just quickly talking about that, because you do represent the plan provider?
Yeah, hi everyone. So I actually work in the renewal team too here at SBMA. And what I can tell you is the majority of groups get rate passes year after year. There are times, like John said, where if the plan is performing poorly, then you might see a slight increase. But usually you wouldn't see more than 10 to 20% increase. And for the most part, the groups get a rate pass.
Okay. When you say performing poorly or performing well, what does that mean?
So as far as, I think that you mentioned that there's a 10 life minimum on these plans. A lot of the times when there's low membership on the plans, there is reserve dollars. I don't know if you've gone into this. They're included into the premium that allocate for claims. And so, for example, if there's a lot of people using the plan, then that's where and there's like high claims on these plans, and that's where you might see a slight increase on your plan. But like I said, for the most part, these plans perform really well, and most groups get rate passes year after year.
Right. So if I could just add to that, Tony, this is a lot of the work our firm did at USI to have conversation with SBMA regarding the plan financials. to understand that the way these plans and their rates have been constructed is on a very sort of conservative basis. So I can't give you an exact statistic. As Julia said, if there's a smaller number of enrollees per employer, then the financial performance is slightly less predictable than if it's a large number of people. However, the rates have been constructed on a very conservative basis so that statistically along the lines of much better than 9 times out of 10, the rates will end up having been slightly overstated. And the way the plan financials are structured, that will help create a reserve for that employer's group for the future, and or may mean a payment back to the employer of a small surplus. But again, to that point, with smaller enrollment, it's less predictable. However, over time, the rates are constructed very conservatively and should lead to no or very small increases over time. Can't guarantee it, but that's our full expectation, and that's the actual experience of SBMA with other clients in these types of programs.
Absolutely. And just to get back to another question, because we only have a minute or two left, someone had asked about, again, the 10 employee minimum. Does it have to be in each one, like 10 for basic, 10 for ultra, 10 for ultimate, 10 for vert? No, it's 10 altogether as long as it's basic to ultimate. That doesn't include the telemedicine, but it is 10, and the telemedicine has a 20. If you want to do just telemedicine only, there is a 20 employee minimum, but that's $10 each. But there's 10 altogether, and then they have their choice between any of those plans. So I do think we answered a lot of them. Again, to learn more about the dental vision, about the accident insurance, hospitalization, to critical illness, and any of the other voluntary plans that we have, please sign up for those programs, or you can reach out to our email address or to Jen here, and we will schedule a very specific session with you, especially if you are interested in getting this set up by September 1st. I would ask you to reach out to Jen right away, and she will look to schedule some dedicated time with your team. So I want to thank everybody. I'd like to thank my guests on the call, from Julie Kinney with SBMA and John Lynch with USI Insurance. We've had a number of other people on the call in case we needed to answer those questions. And I truly appreciate all of you spending the time. This has been recorded, and this will be put on, as soon as we get through this, will be processed and put on our website for review. So thank you, everybody. We truly appreciate your time and your interest in this, as well as your questions. And we will talk to everybody very soon.